I am voting for the defendant because I feel that the hospital did nothing incorrect by accepting Sandra as a patient, although she was also an employee. Her supervisor had no part in her medical team at the time, although she continued to work in other areas of the hospital. And because all most of Sandra's personal information was given the day she was hired by the hospital, her information was already in the hospital, so her supervisor did nothing to gain any information upon her. And although the patient's information is sent to the medical staff upon email, the email is obtained by hospitals in the computer that no one other than staff has access to. And if someone does have maintain access to the computer, only the staff knows the passwords and steps that need to be taken to gain information on the patient, to have access to the patient's information. And because of the rules of HIPAA, medical teams are able to identify the patient properly without sharing any information of the patient or allowing patient information to be obtained by others in the medical facility. And although Sandra's supervisor remained an employee during the time she was a patient, nothing was done improperly for Sandra, and everything was done according to HIPAA law, and basically I saw that all the GINA steps were taken to make sure that she was treated properly. So I agree with the defendant that her care was done properly and none of her information was passed along improperly. So anything that her supervisor has, she had already learned before this circumstance. But maybe Sandra has a poor relationship with her supervisor, so she's creating a hardship for her. I don't know, but I agree with the defendant.